Hello, everyone. It's almost 5 after the hour now. So maybe we'll get started. Um, it's I'm really happy to see so many people attending today's presentation. It looks like there's 55 of us or so in the meeting. And so without any more delay, I just wanted to thank my co-sponsors of the event, Liz Berger of Lifelong and Jane Baker Selican of McGraw House. Thanks for publicizing and helping to put this together. Just so you know, you see you're all muted, and we'll keep you all muted for the meeting just so we don't have any background noise or bumping of mics or anything. That said, you are welcome and encouraged to submit questions. I will be monitoring the chat room, so we'll throw the question in either at the end or during the presentation where it makes sense. And we've blocked off about, between 45 minutes and an hour, roughly, for the presentation. So we'll get right into it. So our guests for today are Dr. William Kelpak, the Tompkins County Medical Director, and Samantha Hilson, Director of Health Promotions. So welcome to both of them. And I'm going to turn over the presentation to them. And I think we're going to start with a PowerPoint. So welcome.
Thank you. Thank you so much for having us, Zach, and for inviting us, and for everyone who is tuning in and watching. So again, I'm Samantha Hilson, and I work at the Health Department as Director of Health Promotion, but I'm also the Public Information Officer. And so during the COVID pandemic, I've been working pretty much solely on public communications that go out to our local media and to the public on social media. So that is the bulk of what I've been doing. And we're really pleased to be here with you today. And I'll let Dr. Kelpak introduce himself as well.
Good, thanks, Sam. I'm medical director at the health department. Sometimes people think I run the entire department, but in fact, our public health director, Frank Krupa, is the administrative head of the department. And he has all the legal and administrative duties of the department. As medical director, I advise the department on policies and procedures, clinical matters, etc. And so sometimes I like to say that I generally have more of the fun, and Frank has more of the headaches. But it's been a position I've cherished, and today we hope to give you an overview of our vaccine rollout effort. And Sam, do you want to put up our first slide?
Yep. All right, so share this and how to get it. Let's see. That you can see that fine?
Very good. It shows up very well on my screen, Sam. So COVID changes very rapidly, as I'm sure you've noticed, day by day, and sometimes even hour by hour. And we've been challenged in keeping up with changing guidelines, changing science, changing data, and very practical aspects of the coronavirus pandemic. What we want to accomplish this afternoon is to give you some overview, but more importantly, answer your questions. So we're hoping to reserve a large amount of our time for questions that you will give to us. We do have questions that we've already received from Zach, which he's collected from people that we'll try to answer as we go along through this presentation. So we're going to update you on the vaccine rollout. We're going to look at how we've been responding, what our structure is for responding, how to access and what the current data is, and talk at length about vaccines. But we also want to talk about what does it take for us to get to the end of the pandemic? What does it take for us to be able to do something more akin to what we used to do in our daily lives? So first of all, Sam and I, on behalf of the department, want to acknowledge, recognize that many of you in this last 24 hours have encountered a very difficult situation of trying to register for the vaccine and finding it impossible at times. And at least finding that no matter how many times you go back to check, no vaccine clinics have been opened up beyond today, Thursday and Friday, and that appointment slots are all filled. We want to later on in the presentation go into that in depth, but we want to also acknowledge that there are issues that you're having when you access our phone system, when you call individuals at the health department, when you try to use the state systems. Some of what's happened has been due to a large volume of people who are interested in getting vaccinated, which is a good thing. We want people to be wanting to be vaccinated, but we don't want to put roadblocks in their way. We don't want to make it an impediment to get registered. As later in this presentation, we'll go on to that in more depth and explain it to you. So Sam, if we could have the next slide.
Mhm.
So I want to explain a little how we respond to this pandemic, how we have been. If we start at the bottom of this list, the New York State Department of Health and the governor's office establishes the guidelines and many of the principles that we must follow as a health department, but also as all vaccine site distribution places and testing sites. Broken down throughout the state are various segments of the state. We belong to what's called the Southern Tier Control Room. That's a consortium of about 6 counties, all of which are grouped together and are hopefully move as a group to tackling this pandemic. Then beyond that, on our local level, we have the Tompkins County Emergency Operations Center, which Frank Krupa heads up as the head of that, and also, of course, as public health director. That brings together all the resources of our county. It brings together in one place communications. It helps us work with our partners, ranging from Cornell to the Cuba Medical Center to GIAC, to all kinds of people throughout the county. And then we have the Incident Command Model, which is what the Emergency Operations Center uses. That's a delegation of responsibilities, such as getting supplies, establishing protocols, communications, and so on and so on. And that model can be made bigger and it can be made smaller as the pandemic changes. Next slide, please, Sam. So we have, and perhaps Sam wants to speak more to this, on the website listed here, one's able to access exactly month by month, almost week by week, what our response has been to the pandemic. Sam, would you like to comment on this?
Yeah, so I just wanted to share this in case folks hadn't seen it, that that every 2 weeks when the Tompkins County Legislature meets, we present a few slides that that we continue to add to this presentation. That is essentially a timeline of the Tompkins County response to COVID-19. And so we started this back in March or April. And so the full document can be viewed on our website. And then if any of you watch the legislature meetings, you'll see that this is the overview that we provide to them. So this is just one of the slides that gives sort of some of the communications activities, but there's usually a data update and whatever is most current that is going on with COVID-19. So Zach also will be able to share these slides, I think, because there are some links in here that that you can use in order to access, for example, the full timeline. Dr. Claybeck is muted, apparently.
Thanks, Zach. I mistakenly clicked mute and I can't get back from there. Thank you. So we want to give you a quick picture of what of the health department, who in the health department has to respond to this. So of course, our community health services, which houses our communicable disease team, those are the people doing contact investigations and case investigations. Children with special care needs, those nurses are brought in to help out the CHS team. Our environmental health division is doing a great deal to explain the measures that need to be taken by businesses and general agencies within our county. It also tends to field a lot of complaints and answer a lot of questions. And it assists the CHS team, the communicable disease team, in carrying out their role. And then of course, Sam and the county's public information office on designing messaging, standing up our website, providing updates and press releases, trying to keep everybody in touch. Next slide, Sam. Sam, next slide. There you go. So our CHS team is assisted by members of other county departments, such as probation, departments you wouldn't ordinarily think would be drawn into this. We are very grateful that the legislature of the county has responded in a lot of supportive ways and are enabling us to stand up our response to the pandemic. In addition, the county administration is totally on board with what we need to battle this pandemic, trying to pull out all the stops that they can. And then we have to mention our many community partners. There are too many to mention this afternoon, but they are significant. Obviously, Cayuga Medical Center, helping to set up those testing sites, helping to set up the vaccine clinic and staff that and provide it. When you compare what we're able to do with counties even neighboring us, but also across upstate, what we're doing is quite exceptional. And of course, in higher education, Cornell has also provided resources, cooperation, and in many, many ways helped the department to make this pandemic response what it has been. Next slide, Sam. So what do we do as a core mission of the department? Certainly it is contact investigation and contact tracing. This is what helps to lower the number of people being infected by the pandemic. It starts with testing. It starts with identifying people who need testing and publicizing who should go and get tested. And that testing, thanks to those partnerships, is robust and it's timely. When we do a test through the Trip Hammer Mall site, we usually get the result, usually the next day, and certainly no longer than 2 days since. That report then allows us to identify a positive COVID case, interview them, find out if they've had significant contacts with other individuals, and begin contact tracing. All of those people, sometimes as many as 90 people of one individual, are contacted, told that they need to go into quarantine, and instructed and educated about COVID and why we're taking the steps that we are. And the initial case is put into isolation so that they won't infect anyone else until after they're no longer contagious. Next slide, please. So quarantine and isolation, two terms that are difficult sometimes for people to keep separated, but are very different. Quarantine is when we think a person has had a significant exposure and they may become sick. And if they do become sick, they will become contagious. What makes COVID-19 different from many other diseases, including influenza, is that you become contagious 2 days or maybe slightly more even from when you become symptomatic. That's very different, and it means this disease can spread very easily. Isolation, though, is separating a sick person from everybody else while they're contagious until after they're no longer thought to be a risk to other people. Next slide, please. So Sam, let me turn this over to you. You're so familiar with crafting this website and the challenges involved. Please address this.
Yeah, so this is just a picture of our homepage for the Tompkins County Health Department. And we are continuously updating and adjusting and trying to make our website more user-friendly as much as we can within this platform that we're working with. And we have a lot of information on our website, but again, over the past several months, it's been primarily focused on COVID-19. So the most important at this moment and of interest to people is our vaccine information page. And so when you go to our homepage, you can click on this icon here with the Band-Aid, or you can click on vaccine information and it will take you to our vaccine information page, which has information about how to register, who is currently eligible, and some frequently asked questions and answers about the vaccines. So I'm sure, as all of you know, well, we've got one more slide and then we'll get back into vaccines. Dr. K, do you want to take this one or?
Sure. So what you see here, the top curve, are our active cases. Think of that as translating directly into the workload of the department, because all of these active cases we need to be in touch with one way or another every day in order to help them understand why they're in quarantine or why they're in isolation and what they can do to prevent the disease from spreading. So that's our workload. And you can see, starting back even before Thanksgiving, how it ramped up, how it increased. The heavy dark line below is our average caseload per day. Per week, our average caseload curve per week. And you can see that that's had a sustained increase from before Thanksgiving. What that means is that we're not out of the woods at all, and that we're still battling a high incidence of COVID in our community. What it also shows is that it's fairly plateaued. So the good news is that it's not worsening. Therefore, our contact investigations must be helping to control the spread. And that lighter colored curve that bounces up and down and goes over that heavy dark one, that's our daily rate. So you can see we, from day to day, will bounce around somewhat considerably in our caseload. And these are active COVID positive individuals. Next slide, please. So I wanted to talk a little bit about how we approach informing people. So these are some primary principles that we use and that we're used today in talking to you. Always strive to provide accurate, practical information that helps people avoid illness and maximize health. Never state more than we know or reassure people without proof. And when appropriate, we try not to hesitate to say we don't know, but if it's possible, we'll find out. Next slide, Sam. So vaccines. So as Sam indicated, our website tries and seeks to be user-friendly and provide information. The challenges of the past 24 hours point out that we have some work to do. And we apologize for difficulties you've had. And we have to acknowledge that not all of them are of our own making. We are limited by what we are told by the state, what we know from the state, what the state chooses to tell us. And the state is further limited by what the federal government is doing. We'll address this more in a moment. But I wanted to talk about, just to review quickly, there are two vaccines available, Pfizer and Moderna. And one thing they differ in is that the Pfizer booster vaccine is at 3 weeks after the first one, the Moderna at 4 weeks. The other difference is that the Pfizer vaccine is approved down to 16 years of age and the Moderna to 18 years of age. Beyond that, there really isn't any clinical reason to choose between one or the other. These are equally effective vaccines and their safety profiles are entirely similar. We want to review a little bit about the research and approval process in order to assure you that these vaccines have not been fast-tracked in terms of safety or data from that point of view. What was fast-tracked is funding, is money, in order to allow the vaccine development process to go forward more quickly than it might have by providing companies with the money to take away the risk of developing the vaccine. So where a company may have been loath to start involving themselves in expensive steps of the process, the federal government providing money allowed them to shorten the process by allowing them to go forward without financial risk to doing many things simultaneously, which ordinarily they would have done in sequence. But along the way, the various phases of vaccine development have not been compromised in terms of quality and especially in terms of safety. Professional medical associations have expressed an opinion about these things. We know the side effects. We know a great deal about these vaccines. We know the most important things. We know how effective they are, 95% in preventing symptomatic disease and especially serious disease. And we know the safety profile of them. We know that not only from the trials with the vaccines, but now in addition, we know it from having started vaccinating the general public back in December. And we have had no real surprises. No real surprises. That's good news. So we know these vaccines are safe. To answer this first question under issues, although they were ramped up and able to be put out quickly, the process has been very similar to any other vaccine. As far as the side effects of the vaccine, many of them are ones that we've been familiar with other vaccines. Typically, people get a soreness in the area where the vaccine is given. Typically, in that first day, they may feel a bit under the weather. They may have sometimes fever. They may have some tiredness, some fatigue. For most people, those are very temporary symptoms where within a day or two or so, the fatigue, the general achiness is gone. The soreness at where the injection is given seems to last the longest and may go on for a couple, 3 days or so. There are people who will have more profound side effects. They aren't as frequent by any means, whereas the ones I mentioned to you might happen in 2/3 of people. The other other side effects are going to be 1/3 of people or fewer. The risk of a really serious event happening from the vaccine is usually limited to just people who have had a serious reaction to a previous vaccine or who have had a serious reaction to a dose of this vaccine. So it's very limited, the number of people who that occurs in, and very, generally speaking, rare. As far as unanswered questions and important considerations, there was one question as to whether it's possible to be able to get COVID and test positive for it even after getting the vaccine. We don't know exactly the answer to that question as yet. The data is still being developed. At this point, we do think it might be possible. We do know that 95% effective against preventing symptomatic disease means that 5% of the people are still susceptible to infection. That's one of the reasons, amongst many that we'll go into, why after getting this vaccine, you still need to take your precautions of masking, distancing, and so on, because you might be in that 5%. Nothing in medicine is 100%. How long does the vaccine protect me, and will I need future boosters? Again, questions that are being answered by collecting further data at this point. These are important questions, but they're not the really important questions of how effective the vaccine is and whether it's safe. So we know a lot about the most important things. And I mentioned after the vaccine, we're all going to be still taking precautions. Next slide, Sam. So how to register. And this is where we need to talk with you, frankly, about what we know about how the system functions and what we think needs to be improved. So you know that there's online registration through our website. That then takes you into a system of New York State, which is set up specifically to work with these types of vaccine clinics. That system shows available clinics and whether there are slots available still to be for you to be able to take one. The limitation in that is that we, as your health department, will not set up a clinic unless we know there is vaccine at that clinic. That goes back to how do we get the vaccine? The vaccine comes from New York State. New York State gets the vaccine from the federal government. All of that is rapidly changing, as you know. It's only been about 1 or 2 days since the current administration announced that it would release all vaccine for distribution to the states. Prior to that, they were holding back 1/2 of the vaccine produced in stockpile until a later date, so as to ensure the supply. Now they're saying production is good, we can release all of the vaccine. We hope to see that result in New York State increasing vaccine allocations to local health departments and to us. Our main limiting factor right now is having vaccine. If we had enough vaccine, we would be able to do more in terms of opening up clinics. But that's our limiting factor. We will not, I repeat, open up clinics without being sure there's vaccine there. We won't do something like Florida has done, where seniors have had to literally camp out from the night before, hoping to be able to get a vaccine at the clinic the next day. And some of them find out the clinic ran out. We won't do that. We will be sure to have vaccine when you register, there's a dose for you. So we typically get knowledge of vaccine delivery about once a week. Historically, it's been on Tuesdays. That may change. It may not be Tuesdays going forward, but so far that's been what it's been. We don't know how many doses we're going to get until we get confirmation on that day. And so we can't create a clinic until after we have that confirmation. We do know what we request, but we don't know for sure that we're going to get what we requested. I did go on to the New York State COVID vaccine hotline this morning and found, as I'm sure all of you have, that it's not operable. I was told, sorry, we have a huge volume, call back later. Unfortunately, that's the situation with that. And there are a number of things that are unfortunate, I think. There was a radio broadcast, I believe, that informed people they should call Tompkins County Health Department if they're interested in getting a vaccine. And when you call our health department, the staff you reach, they're very well-trained and informed staff, but they don't know any more than what's on our website. And we're all beholden to what happens at the state level and what gets passed down to us. So we urge you to use our website for accurate information, to look for our press releases, to try to stay informed in that manner. But by understanding how this vaccine rolls out, I think you can save yourself a lot of anxiety and frustration by knowing that making phone calls to the department won't, unfortunately, give you any more information than our site, and calls to the Office for the Aging, et cetera, also, it won't get us much farther. We do have an email site for questions, email address rather for questions on the slide you see, and we're glad to try to answer questions all the time. And that's one of the efforts that we are putting forward all the time.
Yeah. Well, I just wanted to add a few things. We didn't include here that pharmacies are starting to receive vaccine as well, which I'm sure many of you have heard. As far as we know, the local pharmacies who did receive vaccine this week was a very small amount. And so those appointments also were booked up right away. And I think that it's just, as Dr. Claypack was saying, that, this vaccination of phase 1A and phase 1B, which are the two phases currently, people who fall under those criteria, they are currently eligible. It will take weeks, if not a few months, to vaccinate this population, including many of you. And so we, until we have more of a regular and larger supply of vaccine, it's just going to take some time. And so I know that none of us want to be patient and waiting longer for this vaccine after so many months of the pandemic, but that is the current situation. So again, hopefully pharmacies will also start receiving more vaccine. And I do see a question about, will there be clinics in other locations? Because the current vaccination site is at the Shops at Ithaca Mall in the old Sears building. And currently that is the only site. And that is because of the supply of vaccine that we're getting. It's the most efficient and effective way of us to get the largest number of people vaccinated. And that site is ADA accessible. They are making it so that there is indoor waiting area, that you do not have to wait out in the cold. And right now that is the only site. As we receive more vaccine and as the weeks progress, all of that will change and be, other sites will definitely be considered. And so it's also just a changing process. The email here is primarily for when you're having difficulty with registration, not difficulty in that the site may be down, that the New York State system, it's being overwhelmed with people, which is why it goes in and out. So if you're just getting an error message that the site is not operational at that time, please don't email or call. We can't do anything about it, that it's New Yorkers all over the state are trying to access it. But if you do get to register and you're having some difficulty, or we've had people accidentally cancel their appointments, that's a time when you would use that email address. If you're looking for just email updates and alerts on when we have open new clinics. I would encourage all of you to make sure that you're registered for Swift 911 or the robocalls, which blast out to all landlines in the county, but you can sign up with your cell phone as well, or for email notification. And so that registration is on the Tompkins County website and also on our health department website. And then we also on the vaccine page have an email update that you can sign up for. So again, we're giving a lot of information, but we'll make sure that Zach has this and he can send it around as well. And then I wanted to add that 211 is also always a good resource if you have general questions, that they also are very up to date on what is going on. So let's go to the next one.
I
So
would
these are,
mention, in addition, Sam, the department and Frank Krupa in particular are very, very, very concerned about transportation issues and about accessibility. And right now, with our supplies, our current supplies, et cetera, the mall site is our best bet for being efficient. But that won't be the story as we go out farther. And we're going to be tackling these transportation and people who are shut-ins and et cetera, et cetera. So.
yeah. And right now, with the mall site being the only vaccination site, we encourage people to think through transportation options the same way that they might do to go to a doctor's appointment or to the grocery store. That if you use Gadabout or if you take a bus, however you might go to a doctor's appointment would be the same way that you would get to the vaccination site. All right, let's finish up and then we'll get to some other questions. So Dr. Claybeck, I think this was your list of professional organizations.
Yeah, thank you, Sam. I put this up just to show you that these non-governmental professional bodies are endorsing the current 2 vaccines that are being used. And they range from those who are in general medicine, adult medicine, infectious disease, and of course, public health. So it's not just the FDA or the CDC that's talking about these vaccines. These professional bodies are endorsing them as well. Next slide, Sam. So community immunity, also called herd immunity. And that is what our end goal is. That's what's going to liberate us. That's what's going to stop this pandemic. That's going to be achieved both from natural infection as well as immunity from vaccination. Everyone who is medically able should get the vaccine as soon as they're eligible. And as soon as, of course, we can manage to have the supply to do it. It's generally agreed that it's going to take about 70% or more of the community to be immune in order to stop the spread of the virus and stop the pandemic. Next slide, please. So we know what works, and maintaining precautions is going to be necessary for the foreseeable future. And you all know these, I don't have to mention them. Next slide. Our continuing concerns are to actually discover medications that can make an impact on this disease. We have a couple that make some difference, but we'd really like to find one that works really well. We're worried about co-infection with influenza and COVID. And so again, don't forget, get your influenza vaccine. If you haven't had one this year, it's still not too late, and we encourage you to get it. So Sam probably should address this one.
Yeah, so we've already touched on this, but I just wanted to share the many ways that we're continuing and trying to expand how we get information out and alert the public, especially about as the vaccines become more available. So, so we do press releases that go out to the local media. We have the website that we've shown you. We do community town halls that are virtual. Maybe some of you have attended those every few weeks. And those are usually with our county administration and our public health director, Frank Krupa, and questions can be submitted ahead of time to our communications director, Dominic, and those instructions are on the website. And then I mentioned the robocalls, which are the calls that go out to as many people in the county as we can get to. So those are some of the ways that we're getting information out, but we're continuing to think about other ways. And that concludes our presentation. And so I think with Zach, we're going to go through some of the questions that are in the chat, and he'll field some of those questions too.
All right, so one question that's come up is the concern about allergic reaction to the vaccine. If there's special places that they should go, or they should have an EpiPen available. Can you speak to that concern?
Yes, I certainly can, Zach. It's been a question I've answered many times. The vaccine site, vaccine clinic is medically equipped to handle reactions, ranging from the very minor to the very serious of anaphylaxis. So you can be rest assured that there are qualified personnel that are there to respond to anything that should occur. The second thing is, the good news is these are very simple vaccines. They don't have antibiotics in them. They don't have preservatives. They're not, they don't have a lot of components. So generally speaking, people who have food allergies, bee sting allergies, those sorts of things, it's generally not an issue for them with the vaccine. It really does boil down to more, have you had a serious reaction from a vaccine in the past? And have you had a serious reaction to this particular vaccine? As always, if you have a question, as always, to check out an issue, you should consult your personal physician. There are people who have very scary allergies, and talking to your personal physician is the best way to clarify things.
Yeah, and I just wanted to add that that there are medical staff on site at the vaccination clinic if there are any issues. And that's also why there's a built-in time for folks to wait after they receive the vaccine, that you have to wait for about 15 minutes to make sure that, that you don't have any complications.
I had a question about what kind of information that people need when they make their appointment, ID, Social Security, insurance. What's required at that time?
Sam, do you want to handle that, or shall I? Sorry, can't hear you.
Sorry, I was just trying to stop sharing my screen. Yeah, so we're trying to update our website more about what happens as you go through that registration process. So I may not have all of the information, but you do need to bring a government issued photo ID, so like a driver's license. If you have insurance, health insurance, you should bring your health insurance card. That health insurance is being billed for the vaccine, but if you do not have health insurance, then that's fine, that you won't be turned away. There's no cost to you or copay for the vaccine. And there's also no residency requirements. So, so people from another county could come here, or you could go to another location to get the vaccine as well. And individuals who are eligible based on their employment may need employment verification, but I think for most folks on this call, it would be a photo ID. And the registration process, you go through, and it does ask you quite a few questions. I do not have all the details of what those questions are, but we will have more information on our website about what those are.
And you need all this information at the time of registration, or just when you go to the appointment?
What I said first was, yeah, when you go to the appointment, you need the government ID. Yeah. Mhm.
Just to be clear, any billing that's done is not for the vaccine per se. It's for the administration of the vaccine. As Sam said, people without insurance or underinsured, there will be no co-pays that will be collected, et cetera, et cetera. So it's for the individual, it's totally free. The vaccine is paid for by the government. So the vaccine itself is no charge to a citizen.
I had a question about the timing between a COVID vaccine and if you get the flu vaccine. Is there concern about having the vaccines too close together? Oh, and as a follow-up, the COVID vaccine is a two-part vaccination. So can you talk about informing people about when to come in for the second dose as well?
Yeah. So the issue about the flu vaccine and COVID vaccine, it's actually for any vaccine that the recommendation is there be 2 weeks separating one vaccine and the other vaccine. So if you were to get your flu vaccine, you should not get the COVID vaccine until 2 weeks or more later. If you get your COVID vaccine, you shouldn't get the flu vaccine until 2 weeks or more later. It's not that they know there's a problem. It's just that they don't know. So we don't know if vaccines would interfere with one another. And so they recommend separating them. That separation is true for any vaccine. So if you were to get some other vaccine of some kind, it's still 2 weeks. Let's see, there was another part to that question. It was
about the second dose of the COVID vaccine.
right. So at the time you get your first vaccine, you're going to be given a paper card. It will have the name of the vaccine and the identifying numbers associated with it. Keep that card. You will need that to get your second dose. However, you will also, at that first dose time, after you get that first dose, you will be registered to get your second dose. And you may well be given, if it's possible, a specific time, or at least you'll be put into a registry and automatically called up to get that second dose. Be that as it may, keep track of the time to make sure. No system is 100% foolproof. So make sure you advocate for yourself and make sure the system is working. For the Pfizer vaccine, it's 3 weeks between your first dose and second. For the Moderna, it's 4 weeks. So they're slightly different.
There was a question about being given only half the recommended first dose in order to let more people receive the initial vaccination. Has there been any research on that? Any chance that that is happening locally?
Well, the short answer is no. And the same would be true in terms of only giving the first dose and not giving the second dose until after everybody gets a first dose. That option also is not actively being used. Why isn't it? Well, if you believe in science, then you try to stick with science. And the science that we know is that 2 doses give 95% efficacy, and that they tend to have the side effect profile that they do have. If you deviate from that, we do know the first dose by much more limited data is about 50% effective, but that's much more limited data. And we don't know for how long that 50% lasts. You need 2 doses with vaccines. Some vaccines, you get, some vaccines you get 2 doses and you're vaccinated for your entire lifetime. Some you get 3 with a booster in 4 years. Some you get 3, a booster in 4 years, and then 1 every 10 years. There's all kinds of schedules because as you use these vaccines, you discover how long immunity lasts. And you only know that with experience. And experience will only come as we have been vaccinated for months and years. And then we'll know more about when the booster is needed, if at all. But half doses, that came out of a study that the last reading I had of it was flawed. And I wouldn't put my money on that one at all.
Do you have something, Samantha? I'm still scanning my notes here.
Yeah, no, I just was adding that, reiterating that we are working on a local call center kind of option to assist people with registering once there are more clinics. But I don't have further information about that right now.
So I have been asked about clinics at some of the senior housing centers around McGraw, Conifer, Ellis Hollow, basically independent living, but catering to seniors. Is there any chance that there'll be mobile clinics set up to go to these places?
Right now, as Sam mentioned, the Triphammer site is the most efficient way for us to vaccinate the greatest number of people. And time is disease in this pandemic. And especially now that we have this United Kingdom variant in New York State, which spreads more easily between people. We need to, as rapidly as we can, vaccinate the maximum number of people that we can vaccinate. And the quickest way of doing that is to use our most efficient systems of doing it. It's much more problematical to stand up and staff going out to individual living sites, et cetera. And so for right now, the mall site, with the amount of vaccine that we're receiving from the state, the mall site is our single most effective strategy. As we go along and the supplies of vaccine expand, what we can do and where we do it can expand. And we'll keep you apprised as we make those assessments. Eventually you'll see your private practitioner's office have access to coronavirus vaccine if they choose to, because as we go along, vaccine supplies will increase, making that possible, and also the type of vaccine that's available will make it more user-friendly for a practitioner's office to be able to deliver. The Pfizer vaccine is particularly a problem because it has to be kept so cold.
I was asked to confirm this basic statement of the state of affairs. I'll just read it out. There are no appointments currently available for the clinic scheduled for this week. Each week, usually Tuesdays, once you receive notification of how many additional doses will be dispensed to Tompkins County, then additional clinics will become available. It is expected that up to 14 weeks to administer vaccines to everyone who is eligible in phase 1A, 1B. Therefore, it is important for people to be patient with the registration process. Is that accurate?
Well, I can't speak to the 14 weeks. I don't know that number off off of the top of my head. But I believe all of that, which preceded that, to be a fair statement for where we are currently. The Tuesday day is subject to change. That's not in our control, that's in the state's control. We know that we put in our request. The state allows us to put in a request once a week. We put in for 1,800 doses last week. We didn't know until Tuesday morning that we had 1,800 doses. We hope that we will be able to ask for more, higher amount of doses. We are delivering more doses in our county than many, many other counties are. And the state respects that and looks at it. And they're eager to get vaccine to facilities that can get it into people. They don't want it sitting on the shelf. So if we can show that we can get that vaccine into people, then we will get more vaccine, we believe. So that's our modus operandi. The Tuesdays could be subject to change, but currently that's how it's operating. I see Fran Helmstetter has a hand raised.
Thank you. It takes a great toll on my health to be told to check the website often, make the phone calls often. I have been doing that for 3.5 days, as I think many people here have. I got up at midnight yesterday because somebody told me that more appointments opened up at midnight. And so I'm trying all of those things, and I don't have a solution. There clearly seems to be something amiss with the website, that it cannot make appointments in the future when there will be vaccines here, even though the vaccine isn't here at this moment. But to tell me, as frankly you have done here, to check the website, try to register, is really increasing my anxiety and making me exhausted. I'm sure many people, experience that. I thank you for your work. I'm proud to be in Ithaca. I think you're well organized, but still, this is our basic problem. How to keep thousands of, I'm 86, I have serious health problems, as many people do. I'm no different from a lot of other people, but it is cruel to tell me again and again to check the website when there is no light at the end of that tunnel that's indicated. Thank you.
I appreciate that, Fran, and that's part of why we're doing this today and why we're talking in the way we're talking. It wasn't evident of how great a stress this particular situation would engender until we moved from very targeted vaccine rollout. Initially it was just hospital staff and nursing homes, and then it was another very well-defined group of people. This is the first week that we are really opening this vaccine up to a large population of individuals. And frankly speaking, we're embarrassed and apologetic that the system exposes this vulnerability of it to all of you. And so one of our messages is, this is the way it operates currently, that when we know we have vaccine, then we create clinics, because only then do we know for sure that the state is providing us with vaccine. Up to that point, everything is up in the air. Up to that point, we don't know if the state will say, sorry, something happened and we can't send you a vaccine this week. That can happen. And then we would have 1,800 people with appointments no vaccine, and a lot of disappointed people, plus a big job of trying to get in touch with them all. So we don't want to disappoint anybody. If you get an appointment, that vaccine is there. You can bank on it. But the way it operates is now currently, and subject to change again, on Tuesday, we find out whether we have vaccine. And then as quickly as we can, we set up vaccine clinics. And that's what it will be, because those are all, we set up an appointment for every dose of vaccine that we know we have. And there aren't any more after that. So barring something strange, that's all the appointments.
Yeah, but I just wanted to add that, and we do need to wrap up. I just wanted to add that I think that there is a lot of hope, though, and light at the end of the tunnel, that there will be more vaccine, and that, just like Dr. Claybeck said, we're navigating, unprecedented times as we have for the past 10 plus months, and that this week is another unprecedented example of how best to administer and get the vaccine out. And so, I think things will continue to change, hopefully in a positive light, in improvements, so that people can get these appointments easier. I do believe that it will improve, and we are constantly working with partners and working with our everyone involved here in Tompkins County to make sure that folks can get vaccinated. And I do just want to thank, all of you and the community too, because it's also very encouraging to see so many people so eager to get the vaccine. And so I think that that's really important to acknowledge as well.
And as testimony to this, I think Frank Krupa has communicated with the state of New York, advocating that they send us much higher amounts of vaccine. He's been in there urging the state, expressing his confidence that we can get that vaccine to people. And it's the state that has control of the knob. I see several hands waving. I can linger longer.
That's okay. We'll stick around for another few minutes. I'm going to go. Velocity's had her hand up for a minute here for a while. I see a couple others I'm trying to get to. So Velocity, if you'd like to unmute. You there, Velocity?
Yeah, I'm unmuted.
Yep.
So I understand. I know you're trying very hard, but find a solution. Find a way to get us signed up. Find a solution. Don't say, I'm sorry, I apologize. That's no answer. You have to find a solution for us. We call up and the line's busy. Just wait an hour, the line's still busy. Some people are lucky. They get in, they get the vaccination. Why does one person get the vaccination? Another person has to wait 20 weeks or 14 weeks.
Velocity, can we get the questions though? We don't want to.
Yes, the question is, can you find a solution, or are your hands tied?
Well, I can say that we are putting forth ideas. I think I'm not, as I mentioned, Frank Krupa has all the headaches, and I have the clinical end of the health department. Frank would be able to tell you a little bit more about what our resources would be. And depending on resources, which means people and money and et cetera, there are a number of things that could be done in terms of creating wait lists, in terms of creating systems for, I call up, I want the vaccine. Okay, Dr. Claypack, we don't have any appointments right now, but I'll put you on this list and you'll get notified as soon as we put you on. And if you don't hear back from us, you don't get a message within XYZ time, you get back in touch at this point, et cetera. So those kinds of things might be possible. And but I can't speak to that because I'm not in conversant as much with resources. And that really is part of a discussion that Frank, I'm sure, is having with not only the county, but also with other partners in the area.
All right, thanks. Maybe we'll take two more questions. I see Betsy Hillman get the first one here, and then we'll end up with Ann Rhoda. So Betsy, go ahead and unmute.
Okay. In a way, you sort of answered my question just in what you just said, but I was thinking that it's so, as Francis said, it's like Hunger Games. You know, I was up at 3:30 this morning on the off chance that somebody had canceled an appointment. And so I was wondering whether even something as easy as when you know that you have the 1,800 doses, that the first thing you do is put on the website that the first hour or 2 hours is reserved for people who are 1A, so that you know, that they get at least a chance. And I'm not in 1A, so that's a sacrifice for me to say that. Or alphabetical, just something that I realize that that's in a way a software question, but are your hands tied by state regulations that you can't on a local level make it more easier on people?
I'm not sure exactly, Ms. Hillman, whether the site would, when you register, the site would block us from doing that, but your ideas are very good. And certainly at least knowing what the status would be more accurately when you go to that site is a step that we can take on a local level. And certainly I think if there's nothing standing in our way of organizing people within a phase if we choose to do it that I'm aware of. I haven't heard that the state ties our hands in that regard. So we could do certain things to make it as logical and functional as possible.
Because as an example, my husband was one of the ones who was lucky enough, and he's got it, but I don't have it. He thought that maybe he would be able to register, his spouse at the same time. And now any plans we had around being able to get the vaccine have flown away because I can't get it and he can.
I've heard of other couples in a similar situation.
Yeah, households are sort of relevant.
Yeah. And my wife, who was trying to get her 96-year-old mother signed up to get a vaccine, has encountered all of these same problems all of you have talked about.
Yeah.
And it makes no sense for people to feel like there would be some benefit to getting up at 3 a.m. and trying to register when it just isn't possible. So I feel for you and I understand.
Very quickly, do we know, is there a cancellation thing? I mean, how do we know if there's bound to be cancellations? How do we take advantage of that in a good way, take advantage?
Right, sure. Sam, I don't know. Can you address that?
Yeah, we're working on trying to figure out how that is working a bit more. And so I need to find out a little bit more information about that, because it may just be that if there's a cancellation, it pops up as a random, one appointment. But I'm not sure that if that's how it is working. But again, it's how that state system works. So I will try to find out more about that, and we'll put some information on the website about that.
Do you have any idea on one given clinic how many slots go unused because people didn't show up?
I think it's very few.
I would imagine it's very few, but
yeah.
Yeah, I don't have that information offhand, but right now, at least, these few weeks we've had vaccine, if there is any leftover vaccine at the end of the currently scheduled clinics, which is like what happened last week, that day, if there were leftover vaccine doses, there were some hours on Saturday, I believe, for a clinic, that they will then schedule another clinic. Or those doses will be used at the next scheduled clinic. So, so that's currently how that's working.
All right, so we're gonna end up with one last question, but by Ann Rhoda. Rhoda, you can unmute.
Rada,
Rhoda.
odd in the middle. Uh, if the governor has said that he wants to open it up now to people 65 and older, is that going to make it harder for somebody 85 like me to get it?
It certainly increases the pool. It certainly increases the number of people seeking the vaccine. So,
And are you going to follow that?
I'm sorry, what did you say?
And is Tompkins County going to follow that?
We actually are obligated to follow what the state dictates in terms of phases. So we could not deviate significantly from those phases. So yes, I think you'd have to say it makes it a little bit more difficult, because now instead of let's say there are 950 people over the age of 75 in the county, and now you go down to 65. Now you've added another 600-700 people probably. I don't know the numbers, but yes, it's a bigger pool, and it'll take longer to go through that entire age group.
Kind
All
of
right,
dumb.
well, I think that we have to wrap things up. And I apologize for any of you or many of you that didn't get your question answered. I have recorded the video here, and I'll post it on YouTube. You can find the link on GIAC Senior Program Facebook page. I'll also share it with our contacts at Lifelong and McGraw House. And thank you to both of them for helping to sponsor. Again, my name is Zach Nelson. I didn't introduce myself at the beginning. Here it is at the end. You can get in touch with me at znelson@cityofithaca.org if you need the link. And special thanks to Dr. Kelpak and Ms. Hilson. Thanks for your time. Maybe we can do this again sometime in the future. And it was a very informative and interesting presentation. So thank you.
Thanks very much for bringing this together, Zach.
Thank you.